The second is the environment, so in the middle. What we've found, and I think it's something that all of you have talked about, as well as your peers in the membership feel in their guts is true, is that the signals that we send every day at the workplace really impact whether employees think this is talk or for real. It really does. And we have some quantitative data to back that up. So if you're looking to go to your leadership at your agency and say, hey, we need to get a committee together to start thinking of some barriers to eliminate in our environment, this data can help you with that. And then the third is at the actual programmatic level. There's lots of different types of programs, telephonic versus face-to-face, some that have implementation plans, some that don't, some that have tracking, some that don't. What are the types of programs, incentives, and communications that are actually motivate behavior change? So that you can start thinking about, within the resources that you have in Healthy Worksite Initiative, what are some of the characteristics that I need to make sure implemented in any program that I offer? Just a quick check around the room as you look at these three challenges, which is the most significant? Is it figuring out sort of how to target limited resources when we're offering a wellness program? Any votes for that one?
That's an easy sell.
That's an easy sell, okay. What about the environment?
A little tougher.
What about down at the program level? How hard is that to sort of figure out what types of programs are actually going to work?
How to figure out if those programs are going to work.
What types of programs are going to work? So again, there's so many different kinds. They can be delivered in so many different ways. They can have different features. I wanted to also make sure that this analysis kind of cuts down to, if you're rolling out a weight management program, where should it be offered? What features should it have, etc. What's really going to work for employees? So that's what the third challenge is about. One other thing that I think is important here on page 19, and this gets back to the sort of it's not really about how much, but it's about the right stuff. And what the graph on the left is showing is that the amount of dollars that you budget for wellness doesn't have any material impact, or it doesn't really influence the degree to which employees are going to change their behavior. You can put together a wellness program on the cheap from groups like the American Heart Association, Weight Watchers on campus, etc. Even slush funds if you have them in your agency, to put something out there for employees. It's really about making sure that you're targeting those resources to the things that matter, to what's going to improve your population health.
Question, does this finding assume that implementation is happening
Yes.
across the board?
That's right.
Okay.
That's right.
And the environment supports it?
Yes, so this is assuming, this is just looking at the relationship of a correlation between basically the size of your wellness budget, the number of programs you're offering, and the extent to which employees are reporting that they're making positive behavior. And in fact, it's easy to put a little bit too much out there for employees. So there's been a lot of debate recently in behavioral economics about choice, and is there something called choice overload? And certainly on the retirement planning side of the benefits equation, I think that that's proven to be true. So the more investment options you give employees in their 403B or 401k, the less likely they are to actively manage their account. The more likely they are to just set it on autopilot, so whatever the default account is from the employer. And that's possible with wellness as well. So, again, when you're looking at your HRA and your screening data and you're seeing all this information, really you got to ask yourself, what are the 2 or 3 behaviors we should be addressing? Is it smoking cessation? If 20% of your population smokes, the answer is probably yeah, you want to address smoking cessation. If 10% smokes, you can probably address that through the medical plan by creating the right type of price differentials and incentives. You don't need to spend $10,000, $20,000 on a smoking cessation program. The other thing to think about is just the interrelationship, if you will, between risk factors and conditions. So a risk factor like a lack of exercise is going to affect onset of diabetes, onset of heart disease, et cetera, et cetera. So if you only can start with one thing, it's a pretty good bet you should actually start with exercise unless you have a very high percent of your population smoking. That's a pretty good bet, I bet, for 80%, 90% of the agencies here in this government apparatus. And if they could only target one behavior, they should target exercise. Because that's going to affect pretty much everything you see in your high claims data. Continuing on the HRA piece, and Scott let me know here that there was, I guess, a conversation you all had about whether we should be kind of rolling out the HRA to all the screenings to all employees, or can we do a sample, that sort of thing. And certainly I would say that if your perspective is, can we get statistically valid data, then sampling methodology is a good approach. No one disputes that. But I think what's missing in that equation is that the HRA itself, depending on how you structure your wellness program, is actually an opportunity to start the behavior change process. And I think where a lot of organizations that get into wellness, they first go out with an HRA and or screening, and then there's nothing there. And that lets employees know, that's telling them, well, gee, they're just collecting my health information, but they're not going to do anything with it. They're not really helping. And so I would say that as part of a successful wellness program, you do need a statistically valid HRA. But maybe more important, after a certain level of participation, is not providing the information or collecting the information, but how you help employees use it. That's the more important thing. So just as an aside, the Roundtable offers a health risk appraisal instrument, and we have a feature there where each employee completes it, gets an individualized report, basically, right afterwards. And what we track is the report viewing rate after a certain level of participation, because that's going to tell you whether people are open to the behavior change process, and that's really what you're looking for. So I would just submit that as you're thinking about kind of the next wave of the screening of the HRA, that you roll it out to everyone. That what the doctor is saying, with all due respect, is not the right perspective. So just some food for thought there. But continuing on page 21, basically the theme of sort of how we should be structuring our wellness programs, what sorts of behaviors should we be targeting. There's two things that are going to tell you what you need to do. Basically the health risk profile, probably no surprise there, but your turnover rate. So for some of your agencies that may have an hourly workforce or shift environment, call centers, what have you, maybe there's a little bit more turnover than in other agencies. That's going to affect what you want to invest in. And you can see that on page 23, where you've got sort of some investment guidelines. So if you have a population that's generally unhealthy and low turnover, pretty much investments in exercise, smoking cessation, and a healthy diet are going to pay off. If you have a lower turnover, if you have a higher turnover population, which you can see on the right, the relationship between turnover and return, you want to be careful about where you place your bets. So these are good rules of thumb to follow. As you're looking at your own HRA data, I would look at this page with it. Because this can give you sort of, where do I put my first dollar, right? Especially right now. I've heard some talk that budgets are going to be less flexible or perhaps cut this year, so not unlike a lot of organizations in the private sector having to do more with a lot less. This can help you prioritize where you're allocating those funds.